The second abstract I have to present today is a multi-center study, and we're specifically looking at CAR T-cell therapy in patients older than 80. The elderly patients, unfortunately, have been a little neglected in clinical trials. They're usually excluded for several reasons, and sometimes just solely because of the age. We don't think that age is a limitation to CAR T-cell therapy, but there are other factors such as disease burden, comorbidities, and performance status more than actual age. So in this case, we wanted to focus on a kind of like a patient population that is not very well represented in trials, those who are older, 80 and older. So we, in a multi-center study, we kind of pulled data on all patients who had lymphoma and received approved anti-CD19 CAR T-cell therapy, including the ones that are approved like axicabtagene ciloleucel, tisagenlecleucel, and lisocabtagene maraleucel. So in this study, we enrolled about 88 patients, and we followed them for survival outcomes, and we saw similar response rates as we see in younger patient population, especially younger than 65 or 65 and 80 patients. We saw similar patient response rates and also survival outcomes. So we demonstrated that CAR T-cell therapy can still be efficacious in a patient population that is older than 80. So we shouldn't restrict those patients. There were toxicities too. We see that probably the recovery time is a little longer in these patients, especially neurological toxicities, but majority of patients actually fully recover over time. So our conclusion is that patients shouldn't be restricted for CAR T-cell therapy based on age. There are other factors like comorbidities, performance status, disease burden that may affect outcomes more than actual age. It's important to do patient selection, including doing probably geriatric scores in order to assess patients better, in order to include them for this therapy that is actually curative. So that's it. All right.